The coronavirus outbreak continues to grow with more than 200 cases now reported in North Carolina as testing continues to ramp up. While we've been focusing on facts here at WFMY News 2, the information can be pretty alarming for not only adults but for children too. So we brought in Dr. Jenna Mendelson, who is a licensed clinical psychologist with LeBauer Healthcare and part of the Cone Health Medical Group, to answer some questions. Good morning.
Good morning.
So Dr. Mendelson, the news of the pandemic can make even adults anxious. How do we relate to our children to make them understand and feel comfortable?
Sure. Well, it's uncertain times for all of us, and that can be anxiety producing for children and adults alike. The first thing that I recommend is really being intentional in setting aside time to listen to our children. So making sure to ask them how they're feeling and then really listening when they speak. As parents, it can be so hard when we see our children struggling. There can be an urge to kind of make them feel better right away. And I actually recommend just listening to them first and providing validating statements that show that how they feel makes sense and other people are feeling this way too.
Because the last thing you want to do as a parent is make your child feel worse than they did before you talk to them.
That's right. That's exactly right.
All right, so at this point, we want to get you involved in our conversation. It's our question of the day. Let us know what you think about this. What are you most concerned about with the coronavirus? Is it the coronavirus itself? Is it, of course, the closures and the cases in our state? Or maybe is it childcare, finances, or supplies? Head to WFMY.com/vote now to answer, or also the News 2 app. So we've seen a lot of changes, Dr. Mendelson, with the virus recently, school closures being number one. Lots of cases in our state, so there are definitely changes up and down here. How can we help manage kids' stress levels when it comes to all this new information?
Sure. Well, it's always important to be mindful of our children's news and social media intake, and now is an especially important time to do that. So if you're a family that tends to have the news just kind of running in the background, I definitely suggest setting some limits on when the news is on and what exactly your children watch. It's also important to be mindful of not just what we say to our children, but how we say it. So if you're carrying a lot of your own anxiety, being mindful of if it's coming out in your words and finding some strategies to manage that as well.
I found when talking with my children about it, not using the word outbreak, even though they're young, they don't really know what it means, then that leads to more questions like, well, what is that and how does it work? So not using big complicated words that I can't explain kind of helps.
Absolutely, and the CDC's website actually has a great list of facts about coronavirus in very straightforward, simple language that even young children can understand.
That's a great resource. So let's talk about social distancing, because that is what the CDC is recommending that we do right now. How do you not only practice that as an adult, but then also teach your children that that's the thing that we should be doing right now?
Absolutely. Well, teaching your children about social distancing is actually a great way to empower them in the face of this virus. It's something that they can do to help other people. It makes me think of that Mr. Rogers quote, look for the helper. This is a way your child can be a helper. So this is something we're doing to keep everybody safe. In terms of hygiene behaviors, the first thing is to model them. So invite your children to join you and you can all wash your hands and maybe sing a song together. Providing attention and praise when you see your children engaging in good hygiene, like sneezing into their elbow or making sure not to touch their face. That's a tough one. That
really
could be a good one, to even try to provide a reinforcement system. So setting a timer for a really short period of time. I'm thinking like less than a minute, and providing, seeing how long your kids can go in that period of time without touching their face. And then maybe they get like a sticker or praise with
make
older
it like
kids.
A game.
Exactly.
I love it. Great advice, great tips. I appreciate your advice, Dr. Mendelson, clinical psychologist with LeBauer and Cone Health. Thank you.
Thank you for having me.
Let's take a look at our question here. We asked you, what are you most concerned about? By far, the number of people saying that they're concerned about the virus itself. You can always weigh in on WFMY.com, and you can find more information about coronavirus or the questions that Dr. Mendelson and I talked about here on WFMYnews2.com. Just looking at the To Your Wellbeing section of our website.